Anytime you see any of us here at Campbell Clinic, we are conservative surgeons. We always try to avoid surgery if there's an easy remedy, an easy way to get you back to doing what you want to do relatively pain-free. And so we'll always start with that, if possible, with what's called Bunion Pads, which is a gel pad we can put on to just pad up the outside of the bunion. If it's early on and it's a fairly mild bunion, I may even get you a night splint to sleep in just for a while to stretch out so the bunion doesn't keep trying to fade. This almost certainly won't correct the bunion. What it does is try to prevent you from getting a worse deformity. And so there are things we can do, wider toe box shoes, although as I tell patients, if they want to wear narrow toe box shoes for special occasions, do that. I don't limit folks who feel that that's important. But there are some conservative options that we always like to start with if we can. A lot of patients come to me and they've tried those things, and I'm more than happy to proceed with surgery if needed. But we try to encourage conservative options first. I probably have 6 different surgeries that I perform for bunions, and that depends on the clinical and the x-ray findings. Anything from a fusion back in the midfoot to a fusion at the big toe, to a much more minimally invasive surgery. And I can perform bunion correction through very small incisions to correct a bunion if it's the right bunion deformity. And that's, again, based on clinical and radiographic examination. Patients might not qualify for that, but they'll always qualify for some procedure. There's always a procedure I can perform to correct a bunion. Again, I ask that it not be pain-free bunion that's easily fits into any reasonable shoes. I don't like just doing cosmetic bunion surgery because there's risk to surgery. So if it's pure cosmesis, we need to have that conversation before surgery. But if there's pain and deformity, then there's always a bunion surgery that can be performed to correct that deformity. All of the bunion surgeries I perform are outpatient surgery. All of them you can weight bear on your heel after surgery. You're usually in bed with your foot elevated for a few days just to help with the swelling, but you can get up and get around some even then, but you're up and around fairly quickly. The foot swells for a long time after bunion surgery, really because of gravity. It's the foot and gravity just keeps swelling, and it usually swells longer than patients are expecting, but we have that conversation, and ultimately patients do very well with that surgery. When folks come to me with bilateral bunion surgery, we have to have a long conversation about whether we do both bunions at the same time. The short answer would be yes, I can perform bunion surgery on both feet at the same time. The longer answer would be that you need to understand how disabling that is. It is very difficult to get around and live life, and it could even compromise outcome a bit because it's very difficult to heal weight bear on two feet. So then you're having to fully weight bear on one of the foot, or put more pressure than I would like on your feet and possibly compromise outcomes. Now there are conditions and there are certain bunion surgeries and certain situations that patients are in that the benefit of doing both bunions at the same time outweigh those risks, and we can have that conversation. After bunion surgery, most people do well for the rest of their life and don't have the bunion come back. But bunions can recur. That's a very well-documented complication of bunion surgery, that over time bunions can recur. That doesn't happen often, and if it does occur, we can correct it with another surgery.